On March 16, 2011, Dr. Grant Colfax, the Director of HIV Prevention and Research at the San Francisco Department of Health, gave a presentation to federal officials and community leaders at the Department of Health and Human Services. AIDS.gov spoke with Dr. Colfax about his presentation, Moving Toward Reduced HIV Incidence, How San Francisco Experience Can Inform National HIV/AIDS Strategy Implementation.
I had the pleasure of coming today and talking to HHS about our goal of ending new HIV infections in San Francisco and the strategies that we are going to implement in order to achieve that goal. And those strategies include getting people to know their HIV status by increasing HIV testing, by getting the message out there that we have great treatments available for HIV now, and that if people are infected, that it's highly recommended that they discuss going on treatment with their doctor, and that HIV prevention and treatment really go together in this day and age. And we think that by working together with both prevention interventions and treatment and care interventions, we will end the HIV epidemic in San Francisco. We're working together with community partners, and I think that the great thing about the National HIV/AIDS Strategy, first of all, is that we have a strategy. It's been 30 years for us to get a strategy, and it's really a tremendous accomplishment that in the last year the strategy has been released, and that it really focuses our efforts. It focuses our efforts to be effective and efficient and cost-effective in terms of our HIV prevention and care efforts. The strategy has three goals: to reduce HIV incidence, to increase care and treatment, and to reduce HIV-related disparities. And those three goals are really in keeping with our goals our local goals in San Francisco. So we're moving forward, and we're delighted that there is guidance from the federal government that really resonates with what we're doing at the community level in San Francisco. I would say that also, in San Francisco, we've really emphasized interventions that are efficient, effective, and also address the many factors that we know prevent getting people from getting HIV tested or into effective care. So we know that interventions need to address the stigma, the discrimination, and fear that still continues with regard to HIV in this country today. We're hopeful that the national strategy will really move us forward as a nation in terms of ending those barriers and really achieving the goal of reducing HIV infections over the next 5 years. Know where your epidemic is, really work with populations that are most affected by the HIV epidemic, and put resources into interventions whose outcomes are measurable so that you actually know you're having an effect.
For more information and continuing updates on the National HIV/AIDS Strategy, visit AIDS.gov.